Bismillahirrahmanirrahim. The topic of our discussion is primary biliary cirrhosis. So, primary biliary cirrhosis is an autoimmune disease which is characterized by inflammatory destruction of small and medium-sized intrahepatic bile ducts. So, primary biliary cirrhosis is a progressive disease which results in a non-suppurative inflammation. Non-suppurative means that the inflammation progresses without producing pus. So in this case, only the intrahepatic bile ducts, which are small and medium, are affected. And the large ducts, whether they are intrahepatic or they are extrahepatic, they remain unaffected. The disease is more common in the females rather than the males, the ratio being 9 to 1. And the disease can occur within 30 to 70 years of age. Peak incidence is mostly in 40 to 50 years of age. The disease is often associated with other autoimmune diseases, most commonly Sjogren's syndrome, autoimmune thyroid diseases, and often it is associated with scleroderma. So primary biliary cirrhosis is characterized by a presence of antibodies known as antimitochondrial antibodies. These antibodies are formed against the E2 component of pyruvate dehydrogenase complex. So it identifies E2 component and these antibodies form antigen antibody complex. These immune complexes recruit cytotoxic T cells to the site and cause damage to the ductal epithelium, which results in injury and then complete destruction of ducts. These ducts are either small or medium, and both are present inside the liver. Extrahepatic as well as intrahepatic large bile ducts are spared. Certain other antibodies such as anti-nuclear antibodies and anti-smooth muscles actin antibodies might also be present. The histological picture reveals presence of inflammatory cells in the portal tract. These inflammatory cells include plasma cells, lymphocytes, and macrophages. In certain cases, eosinophils are also present. As you can see here, this is a portal tract and there are inflammatory cells present inside the portal tract. Moreover, the lymphocytes are present in small and medium bile ducts, since only the small and medium intrahepatic bile ducts are involved. The histological picture also reveals focal necrosis of adjacent hepatocytes, which are located in the proximity to affected bile ducts. The hepatocytes also contain specified amorphous eosinophilic bodies known as Mallory-Dunk bodies. These Mallory-Dunk bodies are also present in alcoholic liver disease and non-alcoholic fatty liver disease. These Mallory-Dunk bodies are formed by the keratin and ubiquitin proteins. In the later stages of the disease, fibrosis is also present. The fibrosis is at first present around the portal tracts and then it extends from the portal tracts to form portal to portal fibrosis. The liver cirrhosis might also be present in the end stage liver disease, which is typically micronodular in case of primary biliary cirrhosis. Micronodular means the size of nodules is less than 3 millimeters. Moreover, the gross picture of the liver reveals hepatomegaly, which is due to swelling of the hepatocytes, and hyperplasia. Hyperplasia is occurring due to presence of the inflammatory cells and regeneration of hepatocytes. The disease presents with the non-specific symptoms such as anorexia, nausea, vomiting, and loss of appetite. There might also be history of pain in right hypochondrium. There is no history or no complaint of fever. Jaundice becomes prominent in the later stage of the disease, which is characterized by serum bilirubin levels greater than 2 to 3 milligrams per deciliter. Skin pigmentation might also be present, and there might be a history of steatorrhea as well. Steatorrhea means presence of fat or undigested lipids in the stool. Osteomalacia might also occur. Osteomalacia is a bone disease which occurs due to deficiency of vitamin D. Osteomalacia occurs due to steatorrhea since vitamin D is a fat-soluble vitamin and it is excreted along with the lipids. The diagnosis is based on detection of anti-mitochondrial antibodies, and they are present in almost 95% of the cases. MRCP and ERCP might also be indicated to exclude other biliary diseases. Biopsy is only performed when there is absence of AMA antibodies, and in most cases, the histological picture does not correlate with the clinical picture. Primary biliary cirrhosis is an autoimmune disease, but one thing to remember here is that there is absolutely no role of immunosuppressive therapy. Moreover, ursodeoxycholic acid is given, which improves the bile flow and also decreases ductal epithelial apoptosis. Another thing to remember here is that in case of absence of anti-mitochondrial antibodies, in almost 15% of the cases, anti-nuclear antibodies and anti-smooth muscle actin antibodies are present. So this brings us to the end of discussion about primary biliary cirrhosis. If you have any questions, do let us know in the comment section. Thank you.